What is anxiety? Is anxiety same as a panic attack? Does a panic attack give you a heart attack? Or are they same thing? If you have any of those questions in your mind, watch this video till end to learn more aspects of anxiety. Hey, thanks for tuning into LifeTuber. My name is Gagan. I'm a pharmacist. In this video, I'm not going to talk about any medication. I'm going to talk about my personal struggle with anxiety and how I came out of it. I'm going to talk about the aspects that helped with my personal struggle, my personal battle with anxiety. At one point in my life, I had such a bad social anxiety that I did not want to go out of the house or face any human being. At that moment, I thought everyone out there, every single person was noticing me. They had nothing else to do in their life, but they were there to notice me, how I'm walking, what I'm wearing, what I'm talking, or what I'm doing. Everything, they are there to notice me. So how I came out of this anxiety, I'm going to talk a little bit about the medical terms, explain it to you, different kinds of anxiety. Stick to the video till end, and there is a printable PDF that you can use in exercise to learn other aspects of anxiety and the ways to better deal with in your day-to-day life. Without any further delay, let's get started. I'm going to start this video with a quote. The ancestor of every action is a thought, by Ralph Waldo Emerson. Anxiety disorders. Yes, I'm going to refer it as anxiety disorders because anxiety is not one single thing. 24% of Canadians have claimed to suffer from anxiety in their lifetime. With such a prevalence, it is the most underdiagnosed disorder. Anxiety disorder is high level of distress leading to functional impairment. The most common risk factors for anxiety are family history, or going through a tragic trauma in your life, or having lower level of education, parental deficiency, or overprotectiveness, and even certain chronic illnesses like hypertension, cardiovascular diseases, or even diabetes. Since anxiety is a bunch of disorder, there are two most commonly experienced disorders of anxiety. One is the panic attack, and the other one is generalized anxiety disorder. So panic attack is fear of fear. Example, fear of getting anxious. Whereas generalized anxiety disorder is worry based. You're worrying about something, that's what making you anxious. Now coming to the differences between a panic attack and a heart attack, or how they're related. The symptoms of having a panic attack are very similar to having a heart attack, that are uncomfortable pressure on your chest, squeezing pain in center of the chest area, lot of chest discomfort. But there are certain differences to know if you're getting a panic attack or you're getting a heart attack. The panic attack gets better with time. So it reaches its peaks within 10 minutes, but after 10 minutes, it is usually getting weaned down, whereas the heart attack would not get better. Another thing, panic attack gets better with the moment. If you are moving, it will get better, whereas heart attack pain gets worse when you move. Another thing to distinguish between panic attack and a heart attack is panic attack does not cause shortness of breath. With panic attack, you get over oxygenation. When you're hyperventilating, you're breathing so fast, you're getting over oxygenated, whereas in heart attack you're not able to breathe, so you get less oxygen in your body. So it comes as an intervention in panic attack that the deep breath work, like having deep breaths, does really help. Coming to the point where you're confused if you have a panic attack and a heart attack, or if someone else is having it, there is no point having any assumption. It is always good to seek medical help right away because you'll be saving a life. Even if it's not a heart attack, they'll know it from the lab work that comes out after. It's always good to seek medical help when needed rather than making assumptions. So these are all the medical terms and risk factors. But I'm going to talk about another aspect now, which is our thought process. As shared earlier, our actions are a direct result of our thought process. But where does these thoughts come from? Thoughts are linked to our emotion. And is it possible to change our brain to think better thoughts? Believe me, brain can be trained on everything, and that's exactly what I'm going to explain in the rest of this video. Coming to the thought process and training your brain, the part that helped me deal with my anxiety, our thoughts are linked with our emotions. So where does this emotions come from? Before we get deep into it, I'm going to explain another term, which is cognitive distortions. Cognitive distortions are patterns of thinking that are heavily influenced by our emotions. In the free PDF that I have attached with this video, I have listed 10 different kind of cognitive distortions. One of that kind is black and white thinking. For example, people are ignoring me. It's just an assumption that you make in your mind, and then you start acting based out of it. Or even jumping to conclusion is another one kind of it. Go click the link to get the PDF. Give it a quick read. You'll have better understanding of all the different kinds of cognitive distortions or patterns of thinking that we build in our brain. It is also accompanied with Examining Thoughts Worksheet that I'm going to explain further in this video, how to use it to deal with your anxiety in a better way. So as our thoughts are linked with our emotion, we are going to identify those thoughts and understand them. So then, after understanding, we are going to create evidence to see the situation as realistically as possible. You see, anxiety and negative thoughts are a chicken and egg relationship. As it's in the world that no one knows what came first, chicken or egg. Anxiety leads to negative thoughts and negative thoughts leads to anxiety. It is so hard to go back and find which came first. Like you started feeling anxious first or your negative thought came first. It is different with every person, but our brain cannot distinguish between illusion or reality. For example, when we are in our dreams, I'm sure everyone has dreams. Everyone has experienced dream in their life. Whenever we are in our dream, our brain cannot distinguish if it's a dream or in a reality. For example, kind of dreams I have is I am drowning in water. I have fear of drowning in water because I don't know swimming yet. I want to learn it, but I haven't learned it yet. That's a completely different story. But when we are in the dream, we actually feel it's happening in reality, and then we just wake up out of it. I'm sure it has happened to you too. This is all this practice is about. This practice makes the brain change. So get yourself pen and paper, print the worksheet, and get your work done on your thought pattern. So how does this exercise work? You identify the thought, you understand it, you write it down, and then you differentiate which cognitive distortion category it falls in, and then you create evidence. The more evidence you create against it, the more it is going to help you when that thought comes in your mind again, and the less anxious you'll feel about it. So you list your thoughts that cause you trouble, and then you replace it with better thoughts. For example, for a thought like, I'll lose my job, just replace it with, what if? What if I lose my job? You see the difference? Same, list your thoughts that are causing you all the worries, or those thoughts that makes you anxious. List them and then create more and more evidence against them. Deal and identify with those thoughts first that has caused you a greater anxious events in the past. So you list them and then you create evidence, and then you restructure your thoughts. How do you restructure them? You ask yourself, how likely is this event going to happen? And then look for the worst or bad outcome of it, and then create your rational response. What if this happened? This is how I'm going to deal with this in the future, in reality, with a lot of evidence. That would be your rational response. Doing this exercise daily will really help you change your thought patterns. Trust me, you'll be able to recognize your anxiety causing thoughts right away as soon as it comes to your mind, so you get it before it gets you. I hope you liked the information mentioned in this video. If you liked any aspect of this video, please give it a thumbs up. Subscribe to the channel, become the part of the family, join the community to support each other. Share it with your friends, family, and colleagues so they can benefit out of it as well. And I'll see you in the next video. Let me know in the comments down below if you have tried the exercise or if it had helped you out in any way.